the Minister of Health and the National Coordinator will update you on developments, after which we shall take your questions. May I now invite the chairman of the PTF and Secretary to Government to please make his remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me start by truly apologizing to you for this very late commencement of the national briefing. But I truly know that you appreciate the exigencies of the time in which we are now, and the need for a presidential task force to put in place so many things to deal with the issues that keep arising on a daily basis. Your sacrifices are well noted, and I believe you are doing that for the good of the people of Nigeria and for our nation. So truly my sincere apologies. We keep apologizing, but we are in a state of war, and all of us have a role to play in this. But I truly appreciate your understanding and your support that you have rendered to the Presidential Task Force in the last 1 month. I welcome you all to the briefing for Monday, 20th April 2020. I'm sure you have all followed the developments around the world and in our country in particular since the last briefing. These are developments that drive home the danger that COVID-19 poses to our health and our wealth. Ladies and gentlemen, COVID-19 has claimed the lives of several Nigerians, and the PTF sincerely condoles with all families that have lost loved ones to this virus. Every life is precious to us, and every loss challenges the efforts we have put into this fight while demanding that we do more in our response. On the 17th of April 2020, we lost the Chief of Staff to the President, Mala Abakari. He was fully committed to ensuring Nigeria responded effectively to the challenge of COVID-19, and he died in the line of duty. We will always remember his robust efforts, his dedication, and an unwavering commitment to strengthening Nigeria's capacity to manage the impact of this pandemic. This development has renewed our resolve to remain focused on the response to COVID-19 in honor of the late Chief of Staff and those that have fallen victims of this pandemic. This is indeed not a joke, but a fight that we must all win. Given the increase in the number of confirmed cases in the last week, the PTF remains conscious of the fact that we are far from the end of this outbreak in Nigeria. We therefore must focus even more vigorously on our strategy of increasing testing, isolating confirmed cases, following up with contacts of cases, and managing confirmed cases to recovery. The PTF recognizes regrettably the unintentional violation of the principles and protocols that form the core of our messaging to Nigerians at the funeral of the late Chief of Staff. These principles, for emphasis, include the guidance provided on mass gatherings, social distancing, personal hygiene, and restriction of movements. Lessons have been learned and appropriate measures have been taken to close all gaps. We assure all Nigerians of their safety and the determination of the PTF to combat the pandemic. The significant increase in the number of cases and distribution across states underscores the importance of remaining focused as citizens and as a nation because of the enormity of the challenges ahead. This is the time for all hands to be on deck so that the PTF can improve on its delivery. We must all come together because we face a common enemy and potential risk. We must flatten the curve at all costs and restore our country to full recovery and activity. I shall now invite the Honorable Minister of Health to update you on the situation. Thank you.
The Secretary to the Government of the Federation, Honorable Ministers here present, ladies and gentlemen of the press, good evening. As at today, early today, the 20th of April, a total of 627 persons in 21 states and Federal Capital Territory have been confirmed to have a COVID-19 infection. The 86 new confirmations are distributed as follows: 70 in Lagos, 7 in the FCT, 3 in Akwa Ibom and Katsina, 1 each in Bauchi, Borno, Jigawa, and other states. 21 deaths have been recorded so far, one of whom sadly is Malam Abba Kyari, Chief of Staff to His Excellency the President Muhammadu Buhari. May God rest his soul. 170 people have recovered from COVID-19 in Nigeria and have been discharged, and that leaves 436 persons who are currently actively recovering from the infection. 13 molecular diagnostic laboratories nationwide are activated so far by the Nigeria Center for Disease Control, and the target this week is to double the national testing capacity, which stands at 1,500 per day. Our strategy, now focusing on the community, has kicked off the increased community testing and social mobilization at the grassroots level. The worrying increase in the frequency and numbers of new persons with COVID-19 being recorded daily is attributable to this new strategy in combination with higher community transmission. A new national action plan is under development to adjust and address this development. There is also renewed emphasis on further increasing and improving isolation facilities because testing and finding more infected persons goes with a strategy to accommodate them. There are isolation and treatment centers all over the country to meet the security, privacy, and comfort needs of all persons. The Director General of the NCD is currently on inspection of these facilities nationwide. With regard to imported cases, everyone entering Nigeria from outside the country will be required to enter a mandatory supervised 14-day quarantine in a designated facility. The same applies to contacts of such persons. State governments shall be preparing a minimum of 300 beds for isolation and treatment, and also to explore all options, including engaging hotels for quarantining persons who may have COVID-19 or those who have mild symptoms and need little clinical management. Citizens are reminded to take responsibility through physical distancing, appropriate use of masks or improvised face coverings, maintenance of hand and respiratory hygiene, as well as faithful adherence to the lockdown measures and regulations in place. The use of masks, be they disposable or cloth masks or other face coverings, is advised for all activities outside your home, and now especially in the hotspot states of Lagos, FCT, and as we are seeing, Kano. I would like to encourage the mass production, donation and distribution of washable, reusable cloth masks by philanthropists to vulnerable groups and generally to members of the public to further contribute to reducing the risk of transmission. A strict guide for the use and maintenance of cloth masks is in development and will be publicized. Suffice it to say that your masks must be washed every day and, if possible, ironed. I shall again use this opportunity to talk to health workers to take reasonable precautions when attending to all patients in health facilities and to approach patients with relevant symptoms with a high index of suspicion and observe the universal precautions on infection prevention and control. The federal government has a responsibility and capacity to manage dangerous viral infections safely in the interest of public safety and national security. Please work with the Federal Ministry of Health and the NCDC on surveillance and on referring patients for testing or to isolation and treatment centers. Observe the physical distancing, practice hand and respiratory hygiene, use your masks or improvise face coverings, and comply with government policy on the lockdown. Thank you for listening.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. As stated by the Chair of the PTF, I would like to acknowledge and apologize for the mistakes that were made regarding the burial of the late Chief of Staff. We realize that crowd control failed. We have learned from this and will ensure future events are adequately regulated and follow the task force protocols. The Gudu cemetery has since been decontaminated. The personal protective equipment discarded at the site has been decontaminated, burned, and discarded according to NCDC guidelines. I would like to further clarify the issue of COVID-19 and burial processes. Contrary to what is on social media, the late Chief of Staff's body was properly prepared for burial according to NCDC guidelines and the Islamic faith. The bodies of persons with COVID-19 are stated clearly by the WHO guidelines, and I quote, "Except in cases of viral hemorrhagic fever and cholera, dead bodies are generally not infectious. To date, there is no evidence of persons having become infected from exposure to the bodies of persons who have died from COVID-19, close quote. Therefore, we would like to further assure the public that we will continue to follow the guidelines and protocols we have produced. The NCDC guidelines are very much reflecting the WHO guidelines. We'll also like to assure the public that the task force takes its presidential mandate seriously and is committed to executing it to the best of its ability. We ask for the public to continue to hold us accountable for our actions. We read your comments on social media. We listen to you. We acknowledge the issues that might arise. Please continue to do so. It is the only way we can continue to improve and fight this big challenge we have. In terms of other issues, I just want to briefly talk about the movement of persons across state borders. We continue to be concerned about the movement of large number of persons across state borders. We would like to appeal to state authorities to ensure that this does not happen, as this will further increase the risk of spread. Finally, the Presidential Task Force would like to acknowledge the prime role that the Chief of Staff played in establishing the Presidential Task Force. He fired the first shot against COVID-19. We will continue to honor his memory, and we will continue to do everything we can to overcome this pandemic. May Allah bless the soul of the Chief of Staff. May he find eternal peace. May his family and all of us find the fortitude to bear his loss. Thank you.
Thank you very much. We shall now take the questions. We have 10 questions. I hope we're ready. Yes. Okay, please go straight to your questions.
Good evening, sirs. My name is Juliana Taiwo. I write for Sun Newspapers. SGF, the coordinator, yes, you have indeed admitted that mistakes were made during the burial of the Chief of Staff. But how are you going to give the same privileges to families who may fall under this category tomorrow? Because it's like only the followers can obey, those up there cannot, will not. Then the presidency asked those that were at that burial rites to self-isolate for 14 days. And we know 5 of your committee members were there. How come they are not in self-isolation? Thank you.
Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter on Channels TV. My first question has to do with one of the cases that was reported in Borno State during the week. The person is a staff of one of the NGOs that has to do with IDPs, has something to do with the IDPs regularly. And of course, the source of my information shows that that particular staff visited some of the IDPs in Borno State before he was tested positive. So the question is, what containment strategy do you have for those people in IDP, because they're already exposed to this disease? Then the second question is a follow-up to what my first colleague said. The SGF said that lessons have been learned. I need more explanation of that. Does it mean that we should be expecting a kind of national policy as to how to properly dispose of our loved ones who fall victim to this disease? Are you going to come up with a national policy on proper way to bury them? Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. Earlier, the Minister of Education was here. He said there were going to be online lessons for children that are at home because of the pandemic. Now, there are children on the streets. There are children in the orphanage who do not have the privilege to access that. What's going to happen to them? Is there any plan by the PTF to incorporate them into this plan? Then, again, we've seen flights taking foreigners to their countries. Why is it why is it taking time for Nigerians outside the country to be brought back home? Thank you.
Good afternoon, sirs, and my colleagues. My name is Abiodun Omolara Popola. I work in Voice of Nigeria, Yoruba Service. I will take the opportunity from the Senator Olorunbe Mamora. Please, I'll be asking in English, also in Yoruba. I would really appreciate you, sir, if you can also answer me. My first question, sir. Wow, COVID-19 has shown us a great wake-up sign as a country in the area of the health infrastructures, database management of citizens, state of emergency readiness, food production for its citizens. I want to know what steps are we planning to take out of this lesson as a nation that we have learned. Then my second question, sir. American government went around the world on Saturday, including Nigeria, to evacuate its citizens. What is Nigeria planning such move? Is Nigeria planning such move to bring home their citizens from around the world? Then my last question, sir. What is the government doing about the inconsistency, double standard, and lack of coordination we see? According to the health minister, they told us that no private hospital has been accredited to manage COVID-19. So we like to know, sir, ẹ jẹ́ kí n sáré sọ ní èdè Yorùbá. Ẹ jẹ́ kí n bẹ̀rẹ̀ láti ilé tó gbẹ̀yìn. Àkọ́kọ́ ni wípé àwọn ẹ̀kọ́ tá a ti kọ́ láti àrùn COVID-19 yìí, kí ni ìgbésẹ̀ tí orílẹ̀-èdè Nàìjíríà fi gbé láti lè rí wípé ẹ̀kọ́ tá a kọ́ yìí a máa mú wá sí ìmúlò ní ọjọ́ iwájú. Ẹ̀kẹta ni wípé orílẹ̀-èdè Amẹ́ríkà wọ́n ń lọ káàkiri láti lọ kọ́ àwọn ọmọ wọn padà lọ sílé. Gẹ́gẹ́ bí orílẹ̀-èdè Nàìjíríà, ìgbésẹ̀ wo là ń gbé láti kọ́ àwọn ọmọ orílẹ̀-èdè wa padà wá sílé? Ìkẹta ni wípé sà, a rí wípé ní orílẹ̀-èdè Nàìjíríà àwọn nǹkan kan wà tó jẹ́ bí kùdìẹ̀kudiẹ tó farajọ. Kí ni à ń ṣe láti lè rí wípé irú nǹkan báyìí kò jẹ́ yọ ní ọjọ́ iwájú? Thank you very much, sir.
Good evening, sirs. My name is Nancy Orom Oyedia, reporting for AIT. So my question is very simple. What efforts are made for regular testing of health workers who are on the front line to ensure that we reduce the spread among patients and even their family members? And of course, we hear that there are private hospitals that have been accredited to treat COVID-19 patients. What are the requirements for private hospitals to treat these patients? And another question, before now, I've heard a lot of time people have asked questions if banks can work during this period, but I've gone to a lot of banks, the ATMs are not working, the staff are not there to attend to customers. I want to know what is happening to the banks. And also security personnel, I see a lot of them on the road, checking people, checking the tags, ID cards, and some of them are on mufti. So you get to wonder if they are really security personnel who are accredited to check the compliance. And finally, also, the issue of palliative has become like a national anthem. A lot of people tell you, we haven't received this palliative. My question is, when exactly is the federal government going to start the distribution of palliative to the poor and also the vulnerable? Final question, for the journalists who are on the front line also, I'm aware that some medical practitioners have allowances and other incentive from the federal government. The journalists are also here to educate the people on what is happening and also the effort the federal government is making to help the spread of COVID-19. My question is, for the journalists, what is the federal government doing for them? Thank you.
Okay, good evening all. Rachel from the News Agency of Nigeria. Now, the PTF team, I would like you to react to the complaint by some experts that Nigeria don't really have a clear-cut national response plan that everyone can key into. Some experts said the federal government is doing their thing. Others said the states are doing their thing, and there's no linkage with private sector. So I don't know how we intend to address that rapidly. For the Minister of Health, a lack of PPE is already impacting our response to this virus. I don't know what you further do to address this issue. Many thanks.
Good evening, members of the Presidential Task Force and Nigerians at home. I am Itaire Ikpen of the NTA. First and foremost, there have been reports circulating on Twitter of increased deaths and mass burial in Kano, and people are asking if this is related to COVID-19. Also, 2 ambulances were reported to have evacuated 2 patients around SCC Road in Ushafa area of Buhari Area Council in the FCT on Sunday, and residents around are apprehensive if these are COVID-19 cases and if they should self-isolate. Again, pensioners nationwide are crying that they are running out of food supplies like most families, bearing in mind that we're 3 weeks into the 4 weeks of lockdown so far. They want to know specifically what are the palliative for pensioners in the country. And for the Minister of Aviation, retirees of the defunct Nigerian Airways said that prior to the lockdown, they were expecting their emoluments. And with the lockdown, they want to know if they should continue to wait and hope. And if I should ask, lastly, if you go to Jabi Motor Park at 9th in the Federal Capital Territory, we discovered that you can travel to any location in Nigeria from the park. And this is in complete disregard and defiance of the IGP's recent warning against night travels. So we want the Presidential Task Force to respond to this. Thank you.
Good evening, all. My name is Abbas Adebawale Jima from Daily Trust. The first question is for the National Coordinator. There are reports that in Abuja and in part of the country, the part of the Hajj camp are being designated as isolation center. And some of the staff that work at the airports were apprehensive if it was safe for them to walk close to the isolation center as in offices, or if it is even ideal for the isolation centers to be located close to residents. Also, is another question that the increment in the testing capacity of Nigerians led to the discovery of many Nigerians that have tested positive. And Nigerians are still apprehensive that the testing is still very low, marginally, compared to other countries in Africa, which have a very smaller population than Nigerians. So I think that what is the government going to do about this particular thing? Then another question on the issue of resumption of the schools. You know, there are some schools, there are some classes, those who are supposed to move from maybe from primary school to secondary school, that what is government going to do concerning that if they are not going to be a very serious damage to Nigerian educational development? Thank you very much.
Good evening, everyone. My name is Amaka Ode. I report for Arise News. And my first question really goes to the chairman or the national coordinator. It has to with the fact that you have mentioned, even the health minister spoke about the fact that this high numbers that we're getting in terms of confirmed cases, this is attributed to community spread as well as rigorous target testing. And my question is the IDPs, especially in conflict regions like the Northeast, what are we doing to ensure that, there's testing for them, especially looking at the incident that happened over the weekend with a health professional who research has actually showed us that he went to some of these IDP camps prior to his demise. So we want to get an update on that as well. And the national coordinator, coming back to you, and it still has to do with the banks and all. Well, Nigerians want to know, what are you doing to ensure that bank charges, at least for now, are suspended? People are not going out there to earn a living, yet we're seeing charges upon charges, yet they don't even have access to their funds, but they get debit SMS from their banks. And I wish the Honorable Minister for Humanitarian Affairs was here. I wanted to get an update in terms of the palliatives, because the last time she told us that they were working to increase the number of homes. And of course, the President in his last address also spoke that about 1 million homes should be added to the list. So I wanted to get an update. So if the chairman or the national coordinator has got that information, we will appreciate it. Thank you.
Thank you. We have taken all the questions, and they have been directed at the Honorable Minister of Health, the National Coordinator, the Honorable Minister of Foreign Affairs, the Honorable Minister of State for Health, the Honorable Minister of Aviation, and the Secretary to Government. The Ministers of Education and Humanitarian Affairs are not here, but one or two questions were directed at them. We shall now take the Honorable Minister of Health.
Thank you. Some questions are similar, and one answer will take about two of such questions. One is regard to the NGO, the employee who tested positive and has connections with the IDP camp. The process will be exactly the same. The meticulous contact tracing to find out all those he has been in touch with, irrespective of whether they are displaced persons or not. The same process goes on. It is tedious work. And I want to remind you that when the first index case came in here, 179 persons, contacts were traced. So it is tough work, and it goes on meticulously. That's why this is such a tough job that takes quite a while. With regard to testing in conflict areas, yes, that is a challenge. It is indeed quite a challenge. You remember that the polio, fight against polio to eradicate polio eradication initiative is lingering, had lingered in the Northeast until recently. That is because the drive for routine immunization was also hindered by the same conflict. So the situation with the testing will do the very best that's possible, but you can only operate within the areas that are safe. And if those who we know of are in those areas, the testing will be driven in that area to make sure that services are rendered as always. There is an active PCR laboratory in Maiduguri, and all measures have been taken to ensure that nothing disturbs its function. About the testing capacity, yes, the testing capacity is being ramped up right now. It is true that at the beginning we were doing very targeted testing because we have a large population, and we had limited access to reagents and also the capability for manpower. And we're looking for, first of all, index cases and all their contacts, very meticulous testing. So it's like if you are going hunting, you have to carefully look for your target and go at it, rather than go in and start shooting everywhere. And yes, we have shot many bullets, but did you really waste bullets or did you really get something? So yes, right now that the strategy has changed, we are ramping up the testing, going out into the communities, not waiting for people to come, but going to communities and doing house-to-house testing, diagnosis. Those who meet the criteria are giving testing, and the yield is increasing, as you can see. That's why we have so many that I reported today, some 80. As for the response plan, yes, we have a very robust national strategy, national response action plan, which is under development as I speak to you. Now that we have moved from looking for individuals and contacts to community phase, the action plan is being developed, very robust, and in fact, I went through the draft last night. They are working on it to have something that addresses all areas of the test so that we can have a structured, a different structured approach to taking on this epidemic. Yes, I've taken on about the staff of the NGO visited. The one about out of school children, I think I'll leave that to the chairman to handle. And well, the one about why does it take Nigerians long to get back home, I'll leave the Honourable Minister of State to answer that. And the question of caring for health workers, yes, there is a special package that is being developed for frontline health workers who are in this activity of taking care of corona infected patients. So the PTF is working on it, working on a package that includes not only the insurance but also includes compensation for what the work they do. So there is no neglect of the health workers at all. And the requirements for a private hospital to treat corona is very clear. Corona is such an easily transmitted disease that you don't want to have it in a hospital that is not prepared for it. If you have a hospital that is treating several other cases, perhaps one nurse or few nurses attending to them, you have corona in one room and then something else in the other room, is risky. We do not accept that. We have had some inquiries about private entities who want to build totally new hospitals for that. Yes, we agree with that. Private hospital, yes. Or they want to close down one hospital and convert it for private sector treatment. Yes, we agree with that. But there are guidelines that you'll be given. You must fit the exact design for infectious disease hospitals with regard to air movement and ventilation and so on. And where you go in and where you go out is well laid out. An accreditation committee will come around to look at the hospital, advise you on how to set it up, check that you have the correct personnel. You have to have doctors who are trained for it. You have to have doctors who are trained for infectious disease. You also have to have nurses who are trained for infectious disease. And even those who are the cleaners, the drivers, the gatemen, all of them have to actually have some training in infection prevention and control. So it's quite elaborate, and those who meet those conditions will very gladly be allowed to take part in the management of coronavirus. We shall be very pleased to have the addition of such capabilities in there. With lack of PPE, no, there is no lack of PPE yet. There is enough PPE, but we're extremely careful about our personal protective equipment because we do not know how this virus is developing. So all the PPE we have, we are managing very carefully. We are stockpiling because we need to be able to supply these commodities to our health workers when they ask for them. And so we don't waste any. We have heard that some countries in Europe have run out. In fact, there's a global shortage of these items, and there's some very influential countries that you know are even looking around to look for what to buy. So we are not short of PPE at the moment, but we're still on the hunt for more. We understand that there are, in fact, indigenous manufacturers going into the business of making gowns and masks we encourage them to do that. We had a meeting with the Ministry of Industry, Trade and Investment some time ago and the Manufacturer Association, and we are glad that there are companies and manufacturers already go into this business and in fact go into the production of ventilators. So the ground is open for all of that. I think that is all that concerns the health sector, and I will invite the Honorable Minister of State to respond to the one about foreign doctors, foreign Nigerians who are coming back home. Well, we don't know what they took them for. I can't respond to ambulances that came to pick people up. Maybe if you looked well, it might have been a pregnant woman who was going to deliver. It might have been somebody who had malaria. Did you see the patient or the person they took? Okay, I would like to appeal to everybody not to see an ambulance as a sign of COVID-19. That's not what it is. An ambulance can be doing a large number of things, very many. It can be taking children, can be taking ladies, it can be doing very many things. So the sign of an ambulance does not immediately translate to COVID-19. That is over the top with apprehension. But it does happen, of course, that it can happen, but in this case, I don't believe so. But even then, there is no reason for apprehension, because over 90% of people who have COVID-19 are cured, are curable. That's to say they recover. Let me put it that way. Over 9 out of 10 will recover. So what is the fear about? And only that the numbers that are so large that we forget that many people recover, and the few who get very sick really get very sick. That's just about 4 or 5 out of 100. So the scare for corona, we must take measures not to get sick at all. So you are not one of the 4 or 5, but nevertheless, we must not think that that is going to be the end of the world. If somebody with suspected corona lives next door, that does not really mean much harm for you, so long as you meet all your infection prevention control and social control measures.
Before we take the national coordinator, we'll take the Minister of Aviation.
Good evening, gentlemen of the media. Regarding the Nigeria Airways payment, if you recall, in 2004, they hurriedly liquidated Nigeria Airways without recourse to the workers, and no provision was made for them. And they were ignored for a very long time, until when this government came in. And when we came in, you remember the national revenue was going down. We were in a recession at the time, and oil prices have plummeted from $140 to below $30. Even within that time, Mr. President saw it very important to pay off the workers, and we were asked to compile the list and compute the amount, which we did diligently and sent to Mr. President. Mr. President paid 50% of the money at that time and promised that he would pay the rest. And between PTAD and Minister of Finance have been asked to draw up the modalities to finish paying the balance. That will be done. In civil aviation, or from the Civil Aviation Ministry, we've done our part. We have computed, we have forwarded to government, we've secured the payment, and the payment is going on. And I'm very sure between finance and PTAD, the remaining balance of money will be paid. Thank you very much indeed.
Okay, I think I have a few questions. So first of all, I just wanted to make it clear, as the chairman said, the incident that happened over the weekend was not intentional. It was a crowd control issue. No privileges were given. In a pandemic situation, you cannot differentiate between the rich and the poor. You cannot differentiate between nationalities, neither can you differentiate between race, because the virus itself does not differentiate. So The Presidential Task Force is committed to making sure as we move forward that necessary steps are taken so that this sort of episode does not happen again. In terms of self-isolation, we have clear-cut guidelines for isolation. If you have symptoms consistent with COVID, we will isolate you while we test. If you've had contact with a case of COVID, we will isolate you. If you're coming from abroad, from an area that is of high prevalence, we will isolate you. So those guidelines in terms of self-isolation or quarantine are very clear. In terms of the issue of education, yes, we continue to be quite concerned about the impact of the lockdown and the impact of the COVID pandemic in general on the education of our children. But this is a global issue. We are not alone in this country. And from the point of view of the education community, we are working closely with them to make sure that online facilities are available. The Federal Ministry of Education should be able to provide additional details where required. The other question has to do with what effort is being made for regular testing of clinical staff. Medical staff, well, not only medical staff, healthcare workers are our biggest assets, and we have to protect them. The first step in terms of protecting them is to make sure they have adequate PPE. That's personal protective equipment. The PTF is committed to making sure that PPE is available in every health facility that deals with patients with COVID. Regular testing or routine testing of healthcare workers is not indicated. It is not part of our indication for testing. However, if clinical staff come in contact with a case and become symptomatic, then the necessary actions will be taken to make sure that they're tested and isolated and treated appropriately in the unfortunate event that they pick up the infection. But we don't even pray for it. The other questions had to do with the reports of increased death and burial in Kano. So we have reached out to the state authorities. We spoke to the governor yesterday, and I believe the state epidemiologists are already on this to try and investigate. It's always very difficult to separate social media in terms of what is true and what is not. But at the moment, it's being investigated by the Kano state government, and we will wait for that result. In terms of the Jabi Motor Park, yes, we will reach out to the FCT. This is a responsibility of the FCT authorities to find out what is going on. Hajj camp issue. So I'm sure a lot of you would have visited isolation facilities. We have clear-cut protocols when it comes to accommodating persons with COVID in isolation and treatment centers. Those protocols mitigate the risk of transmission to the general public. And I would like to assure the general public in the event that any isolation or treatment center is opened, wherever it is in the country, those protocols will be followed to make sure that there's no transmission or increased risk to the general public. And then finally, what is the PTF doing with regards to bank charges? So I have been trying to get through to the central bank governor. We will reach out to find out how he would help with this. This is no different to the issues of electricity and support. We very much appreciate the challenges that people are going through at this time of difficulty, and we appeal for their understanding. Banks are private or commercial entities, and you have to negotiate with them. But certainly we will take this forward with the financial authorities. Thank you very much.
Honorable Minister of Foreign Affairs.
Good evening, ladies and gentlemen of the media. The question was in respect of the evacuation of Nigerians and where we are with respect to that. We've just signed and agreed with 2 airlines. We negotiated what we feel is a very good rate, because obviously since the evacuees will be expected to pay
we wanted to get as good a deal as possible. So that's done. The next challenge really is accommodation for everything to be absolutely ready. We're absolutely determined that when we start, that everything should go very smoothly. And so we really want to, take all the necessary steps to ensure that that will be the case. So we, want to make sure that we have enough accommodation for them. At the moment, there are more people who want to come back home than we have isolation centers and beds for them. So we want to make sure that all the, facilities and all the resources are available to cater for them when they come in here. And also when at the departure point, we also want to make sure that everything is taken care of. People are justifiably concerned about the possibility of bringing home people that might be positive, and also just the risk of infections even on the flight coming here. So we have to take all the precautions we can to minimize that kind of risk. So at the airports, having mechanisms to see whether there are symptoms that are displayed by the intending passengers and so forth. And then, of course, we have to now choose which countries we want to start with. We're pitching it at about 200 at Lagos. We're looking at 200 evacuees that we can accommodate at a time. And since they're going to have to be there for 2 weeks, it'll mean we'll have to bring 200 back, then for a period of 14 days, and before we can bring in another 200 for both Abuja and for Lagos. So we'd also have to look at the cities. So the most important part at this stage is obviously to secure the vehicles, the planes, to bring them back, and we've now done that. So hopefully, if we can tie up the other loose ends, we'll hope to start, hopefully, maybe towards the end of next week. Thank you very much.
Honorable Minister of State for Health.
Mo kí alága àti àwọn mínísítà tí wọ́n wà ń jókòó àti àwọn láti ilé ìròyìn káàkiri. Mo rò pé àwọn ìbéèrè tí arábìnrin tí ó béèrè ìbéèrè yẹn lọ bí mẹ́ta. Ìkíní ni pé àwọn ẹ̀kọ́ wo ni a rí kọ́ nínú àjàkálẹ̀ àrùn tí a ń pè ní COVID-19 tó wà nílẹ̀ báyìí. Ní tèmi mo rò pé ẹ̀kọ́ kìíní ni wípé ìlera lògùn ọrọ̀, nítorí pé àjàkálẹ̀ àrùn tí ó ń ṣẹlẹ̀ yìí ó káàkiri gbogbo ayé. Gbogbo ètò ọrọ̀ ajé àwọn orílẹ̀-èdè káàkiri gbogbo àgbáyé ni ó ti fìdí rẹmi báyìí. Àwa náà tí a dẹ̀ jẹ́ ọmọ orílẹ̀-èdè Nàìjíríà, a rí wípé olóye tí à ń ta epo rọ̀bì tẹ́lẹ̀tẹ́lẹ̀ ó dẹ̀ lóye tó jẹ́ báyìí. Ó jẹ́ kí ọrọ̀ ajé wa kó fìdí rẹmi. Ọlọ́run á gbà fún wa láti jẹ́ kí gbogbo nǹkan kó lójú dáadáa. Bákan náà ló ṣe rí káàkiri gbogbo àwọn orílẹ̀-èdè káàkiri àgbáyé. Èyí fi hàn wá wípé tí àwọn Yorùbá bá sọ wípé ìlera lògùn ọrọ̀, òótọ́ ni. Ẹ̀kọ́ kìíní nìyẹn. a ní láti gbára mọ́ ohunkóhun tó bá ti máa bá ìlera lọ. Ìkejì ni pé Yorùbá tún máa ń sọ pé ìmọ́tótó ó borí àrùn. A rí ń sìn yín pé a ní káwọn èèyàn wa kí wọ́n máa fọwọ́ wọn, kí wọ́n máa fọwọ́ wọn lóòrèkóòrè pẹ̀lú ọṣẹ, omi àti ọṣẹ. Eléyìí ó jẹ́ nǹkan tí lẹ́yìn tí COVID-19 gan bá lọ, nǹkan tí a ní láti mú dání ní gbogbo ìgbà nìyẹn, nítorí pé àwọn kòkòrò àrùn tó ń wọnú ara láti ọwọ́ ni ó ti pọ̀ jù tí a ti máa ń rí wọn. So eléyìí jẹ́ nǹkan tó ṣe pàtàkì tí a ní láti dì mú. Ìkẹta ni pé a ti rí nísìn ní dájúdájú wípé ẹ̀rọ tá a máa ń pè ní ẹ̀rọ ayélujára àbí tá a máa ń pè ní online, a lè ṣe ìpàdé lórí ẹ̀rọ ayélujára, a dẹ̀ lè ṣe ètò ẹ̀kọ́ bákan náà lórí ẹ̀rọ ayélujára. Ìyẹn là ń pè ní online studies. Ó wà ń bẹ̀ náà tẹ́lẹ̀ ṣùgbọ́n nísìn tó ti di pé kónílégbélé, ó di dandan yí pé a ní láti wo ọ̀nà míì tá a ti lè ṣe ẹ̀kọ́ àbí tá a ti lè ṣe ìpàdé. Ìyẹn la ṣe máa ń sọ̀rọ̀ yìí pé teleconferencing àbí video conferencing, ìpàdé lórí ẹ̀rọ ayélujára ni. Èyí tí màá tún sọ ni pé ètò ìlera ó ṣe pàtàkì. Kì í ṣe ọjọ́ àjò ni a ní láti máa rí ìkànnà, a ní láti pọn omi sílẹ̀ de òǹgbẹ ni. Àìmọye àwọn ètò tó yẹ ká ti nílẹ̀ tẹ́lẹ̀tẹ́lẹ̀ tí a ní, ṣùgbọ́n eléyìí ń sìn ó ti fi hàn wá wípé gbogbo ètò ìlera àti àwọn ilé ìwòsàn ó yẹ kó wà bó ṣe yẹ kó wà, kí tó ní sí pé a máa sá káàkiri, pàápàá jùlọ nípa ilé ìwòsàn tí a ti ń tọ́jú àwọn tó ní àrùn àjàkálẹ̀. Èmi dẹ̀ ti rí i pé ara nǹkan tí a fẹ́ ṣe nínú eléyìí tó wà ńlẹ̀ báyìí nìyẹn, wípé gbogbo ìpínlẹ̀ kọ̀ọ̀kan ló máa ní irú ilé ìwòsàn bẹ́yẹn, tó ní jẹ́ wípé a ṣẹ̀ṣẹ̀ máa lọ máa sáré láti máa ṣe nǹkan tá à ń pè ní ilé ìwòsàn pàjáwìrì. Àwọn eléyìí jẹ́ bí ẹ̀kọ́ mẹ́rin pàtàkì, ó pọ̀ jù yẹn náà lọ, ṣùgbọ́n mẹ́rin tí máa sọ nípa ẹ̀ nìyẹn. Ìkejì nínú ìbéèrè arábìnrin wa ni pé ìgbésẹ̀ wo là ń gbé fún àwọn ọmọ orílẹ̀-èdè Nàìjíríà tí wọ́n wà ní òkè òkun tí wọ́n dẹ̀ fẹ́ wá sílé. Mo dúpẹ́ lọ́wọ́ ẹlẹ́gbẹ́ mi mínísítà tí ó ń ṣe ètò ilẹ̀ òkèrè, ó ti fẹ́nu bà á. Ìgbésẹ̀ yẹn wà tí à ń wò lọ́wọ́ báyìí, ṣùgbọ́n kí ètò yẹn kó tó lè múnádóko, ó ní àwọn nǹkan tí a ní láti ṣe. Ìkíní ni pé àwọn ọmọ orílẹ̀-èdè Nàìjíríà tí wọ́n fẹ́ wá sílé, yálà wọ́n wà ní ilẹ̀ Amẹ́ríkà ni àbí ilẹ̀ òyìnbó àbí wọ́n wà ní gbogbo àwọn orílẹ̀-èdè káàkiri àgbáyé, a ní láti rí i pé àwọn tá a fẹ́ kó wá sílé yẹn náà kì í ṣe pé wọ́n tún máa dákún àrùn COVID-19 táwa gòtì ń bájà níbí. Ó di dandan wípé ká ṣe àyẹ̀wò, ká rí i pé àwọn tó máa wá yẹn kò ń ṣe àwọn tó máa wá tún dákún táwa gan ṣì ń bájà níbí. Pàápàá jùlọ a lè kó àwọn tí wọ́n ní àrùn yẹn kí a tó kó wọn pọ̀ pẹ̀lú àwọn tí ò ní nínú ọkọ̀ òfurufú, nítorí pé bí wákàtí tí wọ́n fi máa wà lórí ọkọ̀ òfurufú yẹn ó ṣeé ṣe kó jẹ́ wípé ẹni tí ò ní tẹ́lẹ̀tẹ́lẹ̀ pàápàá ó ṣeé ṣe kó ní nípa òye wákàtí tí wọ́n fi máa wà lórí ọkọ̀ òfurufú. Eléyìí ṣe pàtàkì ká lè mọ̀ wípé àwọn tí ò ní a ní kó wọn pọ̀ pẹ̀lú àwọn tí ó ní. Bákan náà ó ṣe pàtàkì wípé a ní láti pèsè àyè sílẹ̀ fún wọn níbí tó yẹ pé tí wọ́n bá dé ibi tí wọ́n máa gbé, bí wọ́n ṣe máa jẹun, bí wọ́n ṣe máa rí ìtọ́jú, gbogbo àyẹn láti wà ńlẹ̀. Ìkẹta ni pé ètò bí wọ́n ṣe máa wá yẹn irú ọkọ̀ òfurufú wo ni a fẹ́ kí wọ́n wọ̀, àti báwo ni àwọn ètò tí báwọn kan bóyá owó ọkọ̀ wá pa, ṣé ìjọba ṣiṣẹ́ tán láti lè san gbogbo owó yẹn, àbí pé ìjọba máa mú díẹ̀ sílẹ̀ tí àwọn náà máa fi díẹ̀ kún. Gbogbo eléyìí la láti rò pọ̀ nítorí pé wọ́n pọ̀ káàkiri orílẹ̀-èdè gbogbo tí wọ́n fẹ́ wá, a ní láti ṣe ètò yẹn sílẹ̀ kí a tó ní kí wọ́n máa bọ̀. Ìkẹta tí arábìnrin wa béèrè ní pé ó dàbí pé kùdìẹ̀kudiẹ wà nínú bí a ṣe ń gbé ìgbésẹ̀ lórí ètò COVID-19. Ó kàn rí bẹ́ẹ̀ ni, nítorí pé COVID-19 yìí kì í ṣe àrùn tí a ti rí rí, ó ṣẹ̀ṣẹ̀ wá náà ni. Bó dẹ̀ ṣe dé yẹn, gbogbo orílẹ̀-èdè àgbáyé láti ibi tó ti bẹ̀rẹ̀ gan, láti China ni o, lọ sí Amẹ́ríkà ni o, lọ sí Britain ni o, lọ sí Italy, káàkiri gbogbo orílẹ̀-èdè káàkiri ni wọ́n ní ìṣòro kan àbí míì láti dojú ìjà kọ COVID-19 yìí. Tí ó bá dà yìí pé ó kù díẹ̀ káàtó náà lọ́dọ̀ tiwa ń bí, kò ṣe nǹkan tó máa jẹ́ kàyéfì. Ṣùgbọ́n nǹkan tí a mọ̀ ní pé a ti gbìyànjú láti rí pé ìjọba àpapọ̀ ni ó wà níwájú tí ó dẹ̀ ń sọ bí àwọn ìjọba ìpínlẹ̀ náà tí wọ́n ṣe láti tẹ̀lé. Ìjọba ìpínlẹ̀ náà dẹ̀ rèé, wọ́n á rí wípé àwọn ìjọba ìbílẹ̀ ó ní nǹkan tó máa ṣe. Ṣùgbọ́n a ní láti mọ irú ìjọba tí à ń ṣe ìtẹ̀ ní ilẹ̀ Nàìjíríà. Ìjọba tá à ń pè ní ìjọba apàṣẹwàá ni federation. Àwọn ìpínlẹ̀ kọ̀ọ̀kan, ìyẹn ló ṣe máa ń dàbí pé ńgbà míì tí a bá sọ fún àwọn ìpínlẹ̀ kọ̀ọ̀kan, torí pé à ń bá wọn ní àpérò tí a fi ń sọ fún wọn pé ìgbésẹ̀ tó yẹ kẹ́ gbèrè lórí nǹkan báyìí. Ìyẹn ni a fi ń bára wa sọ̀rọ̀ nípa wípé kó lè dáa fún gbogbo aráàlú náà ni. Ẹ bá rí, ẹ mọ̀ wípé à ń bá àwọn gómìnà tí wọ́n wà ní ìpínlẹ̀, à ń bá wọn ṣe ìpàdé, à ń bá àwọn kọmíṣánná tí ó wà ní ìpínlẹ̀ káàkiri, à ń bá wọn ṣe ìpàdé lórí ọ̀rọ̀ COVID-19 yìí náà ni. Ìjọba àpapọ̀ ni ó jẹ́ olórí fún gbogbo àwọn ìpínlẹ̀ àti ìjọba ìbílẹ̀. Èyí tí máa fi parí ẹ̀ ní wípé lára ẹ̀kọ́ tí ó wà fún wa nínú COVID-19, ó jẹ́ kí a bẹ̀rẹ̀ sí wo àwọn nǹkan tí a lè ṣe nípa nǹkan tá à ń pè ní àtúnwò àbí research. Nítorí pé àwọn èèyàn wa Yorùbá ní kí àgbàdo tó dáyé ó ní nǹkan tí ẹdìyẹ ń jẹ. Àwọn èèyàn wa káàkiri, pàápàá àwọn tó wà nínú ìgbèríko ó ní bó ṣe ń ṣètọ́jú ara wọn kí òyìnbó tó wá. Àwọn nǹkan tẹ̀ fi ń ṣètọ́jú ara wọn yẹn ó sì wà ń bẹ̀. Ìyẹn la ṣe ń wo kí ni a lè wò nínú àwọn nǹkan tiwantiwa, nǹkan ìbílẹ̀ nípa egbògi ni àbí nípa àjẹsára tá à ń pè ní vaccine. Gbogbo ètò báyìí náà ni àwọn oríṣiríṣi àwọn ètò yẹn Nigeria National Medical Research Institute ó wà ń bẹ̀ tí ó ń ṣe àyẹ̀wò yẹn. A tún ní National Institute of Pharmaceutical Research and Development. Àwọn eléyìí àwọn ètò ilé iṣẹ́ tí wọ́n gbé gbogbo kíní yìí tí wọ́n ń gbé yẹ̀wò náà yẹn pé báwo la ṣe lè ní ètò tiwantiwa tí a fi máa ṣe egbògi àbí tí a fi máa ṣe àjẹsára nípa COVID-19. Àdúrà mi ni pé Ọlọ́run á fún wa ṣe o. Ẹ ṣé.
We shall now take the SGF. The chairman.
Yes, he's done such a wonderful job that I don't have much to do today because he's answered all the questions in Yoruba, and I think that the people at home will be very excited. Well, I think basically all the questions have been answered, but for the purposes of emphasis, there's this question that talks about lessons learned and whether we are coming out with a new guideline. I think that has been answered by the national coordinator, but for the purposes of emphasis is that the fact of the matter is there are guidelines out there that had already been issued. One by the WHO, who first formatted the guideline on the 23rd of March, which has been adopted by the Nigeria Center for Disease Control. And if you go to their website, I believe that guideline is explicit and it elaborates the protocols of dealing with such situations. And I believe that you will help us in broadcasting those guidelines so that at least Nigerians would know what are the processes that are put in place to ensure the safety of our people. There is another question that averted to the fact that some persons have made comments about lack of coordination. Well, I've been in public life for a while. I think from my little experience, this is one of the most coordinated response we've had in terms of national crisis. We've never had coordinated response like this where the government is just providing leadership, but other segments of the community are taking up bold steps, as been exhibited during this time of our national crisis. The involvement of the corporate organizations in this response and the amount of money, their monies that they have raised from their legitimate businesses that they are deploying, in addition to what NMPC and its partners are doing, if you aggregate that and put what the international community is bringing in place, along with religious bodies. This morning I had the privilege of receiving the new primate of the Anglican Communion, who came with a list of what they have done all over the nation and what they are doing, even centrally here. It gladdens my heart that at this very important time in the life of our nation, organizations, faith-based, business enterprises, ordinary Nigerians are rising up to the challenge. We are just providing the leadership to drive the process. But I can assure you that in your own vicinity and community, I know that there are NGOs that are going out of their ways to extend palliatives to the people in their neighborhoods. So this is one response that every Nigerian seems attuned to. And all of us are doing our bits and pieces in different areas of our influence to ensure that collectively we stand arm in arm to fight this pandemic. So in terms of coordination, we have put in place a national response. And virtually, since we began this national press briefing, we've stated in clear terms what the objectives are and what is the containment of the response we are putting in place. So I would, we are not averse to criticisms, but let them be constructive. All these organizations I've spoken to you about have come with value added to the process. They will say, okay, this is the way you intend to do it, but we think we can do it differently. And we have adapted severally to accommodate those kind of criticisms and suggestions. Any criticism that does not provide any solution does not amount to constructive criticism. We are not averse to criticism, but let's have suggestions of how we can improve on the process. We are dealing with a pandemic that nobody knows all about. It keeps evolving with the day. This is a virus that is called a novel virus, meaning that this is the first of its kind. Nobody can predict its attitude. Even people who have established health infrastructure have been overwhelmed with the turn of events in their nations. But we are grateful to God that as a nation, we are able to move at the pace we are moving in a coordinated manner to ensure that we are not overwhelmed. And with your support, we have seen the level of successes that have been achieved. But I always have this at the back of my mind, that we can do better. But it requires the collective resolve of every Nigerian to be able to improve on the processes that we have put in place now and to move the nation forward. The other one has to deal with banks, that they are not open and there is no cash available. There is no cash available in the banks, in the ATM machines. I was just chatting with a representative of the Apex Bank as to why we have shortages in the ATM machines. And the account I'm getting is that one is as a result of panic withdrawals, and two, restocking. Even the bankers are quite apprehensive of handling cash. So it's a combination of so many things, but they are engaging the banks to see as much as possible that the restocking is done as often as possible. The other thing they are encouraging is that why don't we do a lot of our transactions online? But I know the limitation of that. If you want to buy a mudu of gari in the market, the man or the woman selling the mudu of gari might not be receptive to an online transmission, not because he or she doesn't want to, but probably because the facilities are not available. So I know the limitations of online banking. Not very many of our people do online transactions because of experiences they have had with fraudsters or some restrictions. But I believe that they would continue, the Apex Bank will continue to engage with the banks, the commercial banks, to see how much they can do to ensure that at least they soften on some of the processes they have put in place. They got a special exemption on the 30th of March from the president to do skeletal banking. Because like I said in one of the press briefings here, that the banking hall is classified in the yellow group because we don't want people to congregate and not observe the basic rules of social distancing and the rest within the banking halls. So we expect that much of the transactions should be undertaken using the ATM machines. But I have assurances that they would prevail on the banks to restock the ATM machines as often as possible. But also, our people should be mindful of panic withdrawals. If you don't need the cash in your house, don't bother withdrawing it. You are even making yourself susceptible to other vagaries that may happen if you take the money and keep it in your house, now that there are too many people staying back at home. The other issues of palliatives, the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development is not around. And I believe she's busy out there on the fields, trying to ensure that she pushes as much palliatives as possible out there. It's a very tedious task. I think after COVID-19, Nigeria will not be the same again, because there are some basic infrastructure that we have neglected for a very, very long time. And I believe that that will help us now in putting those infrastructures in place so that in case we have another disaster, God forbid, in the future, we will be able to work as a team and as a nation and as a people to ensure that at least whatever we need to do, there are processes, there are locations, there are enumerations that have been conducted about the kind of people that should benefit from certain categories of palliatives. I see the Americans saying that if you file your tax return between 2018 and 2019, you are entitled to certain palliatives because they have an infrastructure. They have a system that helps them in determining what you can benefit from because of your responsibility, corresponding responsibility to the nation. We need that in place. And it will take the collective decision of the people of Nigeria to put that in place. And that's why you have a role to play. I think basically those are the questions. The one about self-isolation, Dr. Sani has dealt with that specifically. I want to assure Nigerians that we are responsible people. We are family members. We have families. We have children. We have spouses. We have loved ones. We have friends like you. That we will not do anything as a presidential task force to put you at risk. Right now, the DG, Center for Disease Control, and Dr. Fiona, the World Health Organization country rep that is on this committee, they are traveling all over the nation. You must have seen them. They have been visiting states, all in an effort to ensure coordination with the states. And in their visits, they visit even the treatment centers at great risk to their lives and to their families. So we will not take any step that would endanger anybody, talk less of putting ourselves at the risk of causing pains and hurt to our loved ones. That is the assurance I want to give you. As our partners in this enterprise, those of you that cover us on a daily basis, our assurances to you is that we will be honorable in our conduct, we will do the needful to ensure that each and every one of you is secured and is protected. Thank you.
Thank you very much. The SGF has just wrapped up today's national briefing. We want to thank our media partners for being patient with us, for staying with us, for reaching out to Nigerians at home, helping us to take the message out there. But two significant things have come out of the briefing for today, and they are right out of the statement of the Secretary to Government. The first is that the significant increase in the number of cases and distribution across states underscore the importance of remaining focused as citizens and as a nation because of the enormity of the challenges ahead. The second, which is related to it, is that we must all come together because we face a common enemy and potential risk. We must flatten the curve at all costs and restore our country to full recovery and activity. With that, I want to say thank you for staying with us today. God bless Nigeria. We'll see you tomorrow.